Hey everyone, today I'll be talking about anatomy of sciatic nerve in brief. Sciatic nerve is the thickest nerve in the body and is the largest branch of the sacral plexus, having a root value of L4, L5, S1, S2 and S3. The sciatic nerve begins in the pelvis, where it lies in front of the piriformis muscle, under cover of its fascia. It then enters the gluteal region through the greater sciatic foramen. Then it runs downwards between the greater trochanter and the ischial tuberosity. It then enters back of the thigh at the lower border of the gluteus maximus muscle. Before proceeding, just a few points of relation of sciatic nerve in the gluteal region. Superficially or say posteriorly, it is related to the gluteus maximus muscle. Deeply or anteriorly, it is related to the following structures: the body of ischium, the tendon of obturator internus, the quadratus femoris, obturator externus, the capsule of the hip joint, and the upper transverse fibers of the adductor magnus muscle. Medially, it is related to the inferior gluteal nerve and the vessels. Coming back to the course of sciatic nerve again, in the back of the thigh, it runs downwards up to the superior angle of popliteal fossa at the junction of upper 2/3 and lower 1/3 of the thigh, and then the sciatic nerve terminates by dividing into the tibial and the common peroneal nerves. This diagram over here shows the entire course of the sciatic nerve. Talking about the relations of sciatic nerve in the thigh. Superficially or say posteriorly, the sciatic nerve is crossed by the long head of the biceps femoris muscle, deeply or say anteriorly, the nerve lies on the adductor magnus muscle, medially it is related to the semimembranosus and the semitendinosus muscles, and laterally it is related to the biceps femoris. Talking about the branches of sciatic nerve, it gives articular branches to the hip joint, and muscular branches include the tibial part, which supplies the semitendinosus, semimembranosus, long head of biceps femoris, and the ischial head of the adductor magnus from its medial side, and has the common peroneal part, which supplies only the short head of the biceps femoris. So this was all about anatomy of sciatic nerve in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.